Good afternoon. This is Anup Mathur here from MedTech Dynamics. I'm joined here by Dr. Samuel Yeak from Tock Hospital. So very welcome, and thank you very much for participating in our first annual MedTech Dynamics conference in Singapore. We greatly appreciate that. We did hear your presentation around electronic medical records. Perhaps if you could share a little more with us in terms of the role of EMR in the healthcare space, largely with respect to Singapore.
Okay. There's a lot of push now from our Ministry of Health, in particular the Minister, to implement IT in hospitals. Until very recently, I think most of the IT in hospitals deal with the administration, with the finance aspects, and the doctors were not using IT systems very much. Since around 2002-2003, we have actually sequentially implemented various IT systems. Firstly, giving information to doctors first, lab information, radiology information, and so on. And then getting doctors to input data, and these are our order entry systems. And we're moving on to doing other things like physician support, clinical notes, and so on. So there's lots that's been happening in hospitals recently, and I think my hospital, my cluster has kind of led the way in the last few years, having developed a unified system across the cluster, the National Healthcare Group, which basically takes care of half the population in Singapore, and all this is funded by the government.
So what I do understand is that the government is taking a lot of initiatives in regards to healthcare informatics and technology in the healthcare space. So with regards to electronic medical records, how do you see it benefiting the end consumer, which is in this case the patients?
Well, firstly, I think the fast availability of information obviously helps. With lab and radiology information online, there's very little waiting to do nowadays. Most information is really at the doctor's fingertips, so they can make decisions quickly based on actual information. A good example I have is a patient who saw me for dizziness, referred by the neurologist. And after having done a thorough ENT examination, ENT surgeon by training, I decided that there was no ENT problem. And I was still concerned that there might have been a stroke that the patient was suffering from. But he had just seen the neurologist, and a scan had been done, and he was told by the neurologist, who was a bit elderly and not so IT savvy, I told him that the scan results were not available. So I kind of told him, let's quickly look at it on the system, and voila, it was there, and the patient was actually indeed suffering from an acute stroke. So that probably saved his life. We promptly admitted him and started him on appropriate treatment. So the fast availability of information was the first thing. What we are focusing now with order entry systems is really then to be able to feedback in real time the doctors, the ordering doctor, when the moment the results become available, to make sure that the doctor actually promptly knows the results, acknowledges the results, and acts on the results. In addition, as we move on, this will then be able to incorporate decision support engines. For example, if you're prescribing medication, to know what other medications the patient is on, the drug interactions, the allergies, doses based on the patient's age, doses based on the patient's lab tests. Say if the patient was suffering from some renal impairment, immediately the system prompts the doctor to lower the dose to avoid tipping the patient over into renal failure. So order entry systems, I think, has great impact in terms of improving the quality of care and keeping the patient safe, or aiding the doctor in keeping the patient safe. There's just too much data nowadays.
So that's excellent. So what I understand is that perhaps we're talking about EMR being able to capture a patient's clinical life history, which only kind of propagates the fact that every time they have a symptom and they go in for treatment, then it's just one record which just pulls out your entire history.
Well, strictly what you're describing is what we are doing next. That's the EHR, the electronic health record.
All right.
Where it actually captures the patient's various EMR in different settings. From basically from cradle to grave, and that's actually the next big move that the ministry is moving towards, and we are supposed to have the first rollout of EHR system by 31st December 2010.
Excellent. So what in your view are the top 2 or 3 challenges that you foresee in the healthcare informatics space in Singapore at this stage?
Well, I think the biggest challenge has always been getting the doctors, the clinicians to buy into a Tock system. And I think in our hospital that's been quite successful in the last few years. Then as we get adoption, then to implement decision support, which is not overwhelming the doctors. With so much information, we can overwhelm the doctors with decisions. And to select out decisions which are pertinent to patient care, which the doctor feels is important. I'll give you an example. With drug allergy checks, doctors typically cancel about half the prescriptions. That's in our surveillance, and that's pretty good. That has potentially saved half the patients from medication errors from allergies. Currently, our rudimentary decision support, which is basically a commercial kind of application, doctors cancel the prescriptions only 6% of the time.
Okay.
So meaning in 94% of situations, they ignore the prompts. Now that is the danger of a cry wolf phenomenon.
Yes.
That you just want the doctor too much, after a while he ignores it. When it's really important, he doesn't hear it anymore.
Correct.
So building good decision support is technically very challenging, and it takes doctors, clinicians who are interested to drive this.
So thank you very much for your time, Dr. Yeak, and we really appreciate you making time to come to our conference once again, and we look forward to a partnership going with you going forward. Thank you so much.
Thank you.